Welcome to G Fun Facts Online, where we dive deep into the science that's changing our world. Today we're talking about a drug that's been in medicine cabinets for over a century, but is now being reimagined for a revolutionary new purpose. What if we could tell our own immune system to calm down, to fight smarter, not harder, especially inside our lungs? It sounds like science fiction, but the key might be a surprisingly familiar molecule: heparin. Most people know heparin as a blood thinner, a workhorse drug used to prevent deadly clots. But it turns out this complex sugar has a secret life. Scientists are now harnessing its hidden talents to engineer immunity, turning this old drug into a cutting-edge weapon against some of the most challenging respiratory diseases, from COVID-19 to asthma. And the secret to unlocking this power is as simple as breathing it in. The story of heparin starts back in 1916. A second-year medical student named J. McLean, working at Johns Hopkins University, isolated a substance from dog liver tissue that could stop blood from clotting. His professor, William Howell, named it heparin after hepar, the Greek word for liver. For decades, that was heparin's claim to fame. It became an indispensable tool in modern medicine, preventing deep vein thrombosis and pulmonary embolisms, and making procedures like heart surgery and kidney dialysis possible by keeping blood flowing smoothly. Its mechanism is elegant. It supercharges a natural protein in our blood called antithrombin, which then puts the brakes on the key factors that create clots. But as scientists looked closer, they began to notice heparin did much more. It had anti-inflammatory, antiviral, and even anti-cancer properties that had nothing to do with blood thinning. This was a pivotal moment. The realization that heparin could meddle with the immune system opened up a whole new field of research. Early hints in the mid-20th century showed it could influence allergic reactions. But the how was a mystery. It wasn't until the age of molecular biology that we unraveled the secret. Heparin is a highly negatively charged molecule with a unique structure. This makes it a kind of molecular magnet, allowing it to bind to a huge variety of proteins, including the key players that drive inflammation. This ability to grab onto and influence cytokines, chemokines, and even immune cells themselves laid the groundwork for a new therapeutic idea, using heparin not as a blood thinner, but as a precise immunomodulator. To understand why this is so exciting, we need to think about the lungs. With every breath, we inhale a constant stream of dust, pollutants, and microbes. Our lungs need an immune system that's both incredibly powerful and exquisitely controlled. It has to eliminate threats without causing so much inflammation that it damages the delicate tissues we need for breathing. In diseases like acute respiratory distress syndrome, or ARDS, this balance is shattered. We saw this dramatically with severe COVID-19. The lungs become a war zone, flooded with inflammatory cells and chemical signals. This cytokine storm leads to fluid buildup and tiny blood clots in the lungs, smallest vessels, impairing breathing and potentially causing total organ failure. In chronic diseases like asthma or cystic fibrosis, it's a slower burn, but the same principle applies. Persistent inflammation gradually destroys lung tissue. This is where inhaled heparin comes in. The logic is compelling. Instead of flooding the whole body with a drug, why not deliver it directly to the battlefield? By nebulizing heparin, turning it into a fine mist that can be inhaled, we can achieve a high concentration right where it's needed most, in the inflamed airways. This targeted approach dramatically lowers the risk of systemic side effects, most notably bleeding, because the overall dose entering the bloodstream remains very low. It's a way to hit the problem hard without causing collateral damage elsewhere. So how does inhaled heparin actually engineer our immunity? It's not one single trick, but a symphony of molecular interactions. First, it tames the cytokine storm. Cytokines and chemokines are the signaling molecules of the immune system. They're the messages that tell immune cells where to go and what to do. In ARDS, or severe COVID, the body screams out too many of these signals at once. Heparin acts like a molecular sponge. Its negative charge allows it to bind to and neutralize a wide range of these pro-inflammatory molecules. For example, studies have shown that heparin can grab onto key cytokines, like interferon gamma and interleukin-6, preventing them from docking with their receptors on cells. This effectively turns down the volume on the inflammatory alarm, short-circuiting the cascade of damage. It also disrupts the pathways that guide immune cells to the lungs, reducing the number of inflammatory recruits arriving at the scene. But heparin doesn't just mop up signals, it directly influences the immune cells themselves. Take neutrophils. They are the immune system's first responders, but in their zeal, they can cause a lot of damage by releasing destructive enzymes. Heparin has been shown to calm them down, reducing their ability to stick to blood vessel walls and migrate into lung tissue. It also inhibits them from releasing their damaging cargo. Then there are mast cells, the sentinels of the airways, famous for their role in allergies. While they naturally release heparin themselves, adding more via inhalation seems to have a moderating effect. It can specifically inhibit mast cells from producing certain pro-inflammatory cytokines without affecting their other functions. But perhaps the most sophisticated trick heparin plays is with regulatory T cells, or TREGs. You can think of TREGs as the peacekeepers of the immune system. Their job is to suppress excessive immune responses and maintain balance. Incredibly, studies have shown that heparin can help the body produce more of these TREGs and enhance their function. This effect seems to be completely separate from its anticoagulant properties, which opens the door to creating designer heparins that are purely immunomodulatory, with zero bleeding risk. By boosting the TREG population, heparin helps the body's own natural system for resolving inflammation. As if that weren't enough, heparin also has a direct antiviral dimension. This became especially relevant during the COVID-19 pandemic. The surface of many viruses, including SARS-CoV-2, is designed to lock onto molecules on our own cell surfaces. The spike protein of SARS-CoV-2, for instance, has a high affinity for a heparin-like molecule called heparin sulfate that studs our lung cells. Inhaled heparin acts as a decoy. It floods the airways and competitively binds to the virus spike protein, effectively trapping it and blocking it from ever entering our cells. This multifaceted ability to act as an antiviral, anti-inflammatory, and anticoagulant agent all at once makes inhaled heparin a uniquely powerful candidate for treating complex respiratory infections. This all sounds great in theory, but does it work in people? The clinical evidence is growing, and it's largely promising. The COVID-19 pandemic became a major proving ground. An international study analyzing data from nearly 500 hospitalized patients found that those who received inhaled heparin were half as likely to need a mechanical ventilator and had a significantly lower risk of death. Other randomized controlled trials confirmed its safety and showed that patients on inhaled heparin needed less supplemental oxygen and had better lung function. Crucially, these studies found no changes in blood coagulation, confirming that this local therapy is safe. In the fight against ARDS, the results are a bit more mixed, which is common in medical research. One trial found that nebulized heparin significantly improved respiratory status, reduced the number of days on a ventilator, and shortened ICU stays. However, a larger study called the Charlie trial did not find an improvement in the primary endpoint of physical function at day 60. But even in that study, there were encouraging signs. Fewer patients in the heparin group went on to develop full-blown ARDS, and more survivors were able to go home. This highlights that we still need to figure out which specific patients benefit most and what the optimal dose is. For chronic diseases like asthma and COPD, a meta-analysis of 26 studies found that inhaled heparin significantly improved lung function with a good safety profile. Early research from the 90s suggested it could prevent exercise-induced asthma, and recent studies have shown it can reduce airway hyperreactivity in children. The story isn't a clear win everywhere, though. In cystic fibrosis, a condition with thick mucus and chronic inflammation, A pilot study of inhaled heparin unfortunately found no significant improvement in lung function or inflammation markers. Likewise, in treating smoke inhalation injuries, a meta-analysis found that while it could reduce lung injury and time on a ventilator, the findings were controversial, with some individual studies showing no benefit. This scientific honesty is important. Inhaled heparin is not a magic bullet, but a promising tool that needs to be refined and targeted correctly. Of course, putting this therapy into practice has its own challenges. The type of nebulizer used is critical. Vibrating mesh nebulizers are generally better because they create a finer, more consistent mist, ensuring the drug gets deep into the lungs. For patients on a ventilator, you have to be careful that the sticky heparin aerosol doesn't gum up the machine's valves. The molecule itself is large and fragile, so researchers are exploring advanced delivery systems like nanoparticles to protect it and allow for a more sustained release. But the biggest question has always been safety. The primary concern with any heparin therapy is bleeding. However, study after study has now shown that when inhaled, heparin has minimal systemic absorption and doesn't affect the body's overall clotting ability. While minor issues like blood-stained sputum can occur, medically significant airway bleeding is very rare. So where do we go from here? The journey of heparin, from a simple blood thinner to a sophisticated immune engineer, is a powerful example of scientific discovery. The future lies in further unraveling its complex mechanisms. This could allow for the creation of those designer heparins, molecules chemically tweaked to maximize their anti-inflammatory power while eliminating their anticoagulant effects entirely. We also need larger, more definitive clinical trials to firmly establish its role in treating various lung diseases and to explore its potential as a preventative or prophylactic treatment for high-risk individuals. Inhaled heparin represents a paradigm shift in how we approach inflammatory lung diseases. By taking a century-old drug and delivering it in a new way, we're learning to modulate our own immune system with a precision that was once unimaginable. As this research accelerates, it may just become a cornerstone therapy, offering a much-needed breath of fresh air for millions of patients around the world.